Hi guys, welcome to our fourth interview. Today we're here with
Dr. Stephanie Nelson.
And we're going to be interviewing her about anxiety in students. So my first question is, do you encounter students with anxiety?
Yes, absolutely I do. I encounter students with anxiety that is documented by an outside provider. And sometimes I encounter students who are most likely experiencing anxiety that I can tell by their symptoms. But as a school counselor, my role is not to diagnose, it's to be educated about symptoms and then refer out and help families to help their students appropriately.
Okay. And when you notice anxiety in students, what does that typically look like when you see it?
That's a really great question because anxiety manifests in a lot of ways, right? So sometimes it will be physical symptoms and sometimes behavioral symptoms. So behavior, for example, could look like avoidance. A lot of times students will avoid coming to school. It could look like perfectionism, always having to have everything look and be perfect. Sometimes it is, so we said, what do we say? Avoidance, perfectionism, excessive worry. Excessive worry, feelings of panic, and that kind of leads into some of the more physical symptomology. Sometimes during the day, we'll have students, we typically say that they're in crisis because they might be experiencing symptoms of anxiety like heart racing, sweatiness, feeling like you can't breathe, even in some cases throwing up or fainting. So it kind of varies depending on the person and how their anxiety manifests, whether it's behavioral or physical or both, sometimes both.
Okay. And can you describe any risk factors?
Yeah, so I think risk factors for anxiety are kind of the age-old nature versus nurture, if you've learned about that in psychology. It can very much be genetic. It can very much be the environment that you're in or grew up in, or a combination of both, right? So like if you have anxious parents and their anxiety kind of spills over, you might be more likely to experience anxiety because that's kind of what you know. Or if they have like a genetic precursor, and then you might experience it. Or maybe you're living in an unstable environment and it's not predictable, and that can really contribute to anxiety. And unstable environments could be things like, unfortunately, an abusive or neglectful type environment, or even just students who are in transition, moving around a lot and don't have that structure. That can definitely manifest in anxiety as they grow older.
Okay. And our fourth question is, do you see more students coming to you about anxiety from school or anxiety from outside situations?
Yeah, that one's a little bit of a hard one too. I think both again, right? Because they're kind of like one can lead to the other or vice versa, right? So if you're already predisposed, like we talked about in terms of just having more anxiety, then things at school could trigger you. You know, if you're a perfectionist, and that's how your anxiety manifests, you might avoid going to school for fear of not performing. If you're already in an environment that's unstable and you're at school and you have unstable peer relationships, that can contribute to maybe more anxiety, if that makes sense. And I think you had a question about how to manage it, right?
Yeah.
Was that the next one?
Yes.
Okay.
So what were some strategies that you can recommend to help students that are struggling?
Yeah, so I think that's another twofold, depending on if the symptoms are manifesting a lot, especially at school, as physical symptoms. That could be more like, you're feeling anxious at school. We, number one, want you to go talk to someone, a trusted adult, okay? And your counselors are here to support you no matter what. So that would be a good resource. And counselors can help you come up with these strategies I'm about to tell you too. So that's really important. But for anything physical that comes on, When I'm working with students in my office, I try to help them in the moment kind of think through some mindful activities or calmness techniques. Maybe it's going and rocking. Maybe it's identifying the five senses. What's one thing you can hear, see, smell, touch, taste, that sort of thing. Maybe even some cold water on the face. And then to help students who are just chronically struggling, I think it's really important that students have routine or structure in those cases and know, again, that they can come to adults who can help with maybe informal or formal accommodations. There are different things that help different students depending on what type, how they manifest their anxiety. Maybe it's brain breaks, maybe it's some extended time. And we won't get into the details of how that happens, but we recognize that certain students may require certain accommodations. And so, I think that helps to answer the question, right? And think like as a counselor too, it's important that school counselors stay on top of theory and techniques that help students, like understanding maybe cognitive behavioral therapy. And again, we're not therapists, but having these sort of skills in the moment or for short-term counseling is helpful. So helping a student to reframe their thoughts so they have different behaviors, maybe going from an I can't to an I can, and empowering and strengthening this, like using the student's strengths for them to come up with solutions on their own, kind of empowering them. That might help them in certain situations that are causing them to procrastinate or avoid.
Unfortunately, the screen recording did cut off right before we ended the interview, so I just wanted to give a big thank you to Dr. Nelson for joining us, and all of your information will really be helpful to students that struggle with anxiety either inside of school or outside of school. And I really agree with the information that you gave us regarding how the environment that you're in can affect your anxiety. And I also agree with the strategies that you gave us. They will all be really helpful to everybody who watches this interview. So thank you so much, and